Welcome to today's webinar, Dentistry for Dummies, where we talk about all things dental. In today's segment, we will be talking about a discontinued product called ATRIDOX.
Tonight, we have 3 dental hygiene students joining us who will be discussing if they think this product should be brought back onto the market. Do you guys want to introduce yourselves?
Hi, I'm Nicole from Southern Ontario Dental College, and today I will be talking about why ATRIDOX has been discontinued.
Hi, I'm Carolina from Southern Ontario Dental College. Thank you so much for giving me the space to talk about all great things about ATRIDOX.
And I'm Kiara, also from SODC, and I'll be discussing why ATRIDOX should not be brought back on the market and its disadvantages.
Thank you for joining us, guys. Rachel, do you want to start us off with a brief overview of what periodontitis is?
Hi, Zahid. Thank you. Definitely. So what is periodontitis and how is ATRIDOX useful? Initially, plaque biofilm builds up on the tooth surface, extending beyond the gum line, and the bacteria feed on gum tissue and bone. As a result, your body sends white blood cells to the area to kill the bacteria, and this causes inflammation known as gingivitis. This results in your gums bleeding when brushing and flossing. With proper oral care, gingivitis is reversible. However, without proper oral self-care, if gingivitis persists, eventually the surrounding tissue and bone that holds the tooth in place begins to reabsorb. This is known as periodontitis. Unlike gingivitis, periodontitis is irreversible. However, periodontitis can be managed and stabilized with proper care and treatment. Zahid, can you explain how ATRIDOX is used in terms of treatment?
Yeah, of course. In terms of treatment, ATRIDOX, which is a dioxysilene hyclate 10% gel, it is known as a major advancement in the field of periodontology because it is locally applied antibiotic gel. It penetrates deeply into the periodontal pockets for those with periodontal disease. Its major contributions in research show that it aids in gaining clinical attachment reduction on probing depths and a reduction on bleeding on probing. Additionally, it is said to reduce the anaerobic bacteria in dental plaque. Rachel, can you explain how exactly it works?
It works as follows. ATRIDOX is placed below the gum line where the harmful periodontal bacteria thrive in the periodontal pocket, and just one syringe treats multiple areas. The gel morphs into the root shape and fills spaces between the teeth and gingiva. ATRIDOX turns into a wax-like substance when it is in contact with saliva, and then for a period of 7 days, doxycycline is released in a controlled manner in the infected pocket. ATRIDOX does not need to be removed because it is bioabsorbed.
Okay, thank you, Rachel. Carolina, let's get into some benefits of ATRIDOX.
Sure. Okay, so first I want to start talking about how great this product is in the treatment of chronic periodontitis because it promotes clinical attachment, probing depth reduction, and bleeding reduction as well. A clinical study was conducted in 45 subjects with periodontal disease, and it demonstrated that a single treatment with ATRIDOX resulted in the reduction in the numbers of many bacteria, such as P. gingivalis, P. intermedia, and others, in subgingival plaque samples. And also no overgrowth of opportunistic organisms, such as gram-negative bacilli and yeast, were observed.
Well, Carolina, sorry to interrupt you there. That study does show some great results. However, according to the FDA data sheet on ATRIDOX, the clinical significance of these findings is not really known.
Okay, that might be true for this study in particular, but we can't ignore the fact that many patients have benefited from this product. It does not require local anesthesia for placement, and the way the product is delivered allows for controlled release of drug for a period of 7 days.
Definitely. Of course, some people are going to benefit from it. However, we can't ignore that people have also experienced a lot of side effects. Some common ones include flu-like symptoms, gingival discomfort, pain or soreness, headaches, pressure sensitivity on the tooth that it was applied to. And then less commonly, they've also reported high blood pressure, tooth mobility, tooth or gingival pain, abdominal or pelvic pain and bloating, cough, diarrhea, red gingiva, indigestion, muscle aches, tooth sensitivity to hot and cold, shortness of breath, sleeplessness, sore throat, and nasal congestion. And we should also mention that it can interact with anticoagulant medication, methoxyfluoride anesthesia, and normal birth control.
Thank you, Carolina and Kiara. We have dived into both positives and negatives of ATRIDOX and can see that you both make valid points. Nicole, can you discuss why ATRIDOX was discontinued?
Well, the reason for that was actually due to the potential serious risk for psychiatric disorders as determined by the FDA.
Thank you, Nicole. That's an interesting point. Zahid, what do we have next?
Since we are nearing the end of our segment, we're going to open it up to a question and answer period for our viewers.
Okay, so a viewer just asked, is periodontitis reversible?
Well, I can answer that one. Periodontitis is not reversible, but it can be stabilized with regular dental visits and adequate oral self-care.
Interesting. So we definitely want to avoid getting it. Okay, next question is, who is this product right for? And could anybody with periodontal disease be eligible for this treatment?
I can answer this question. So, ATRIDOX should definitely not be used on patients who have a hypersensitivity to doxycycline or any other drug in the tetracycline class. And people that are pregnant, breastfeeding, or under the age of 18 also cannot use this product.
Okay, so it's definitely not for everybody. Oh, we have another question that just came in. How often can it be applied?
Oh, I've got that one. Application of ATRIDOX may be repeated for 4 months after initial treatment.
A bit of a buffer period appears to be needed. And finally, what looks like our last question of the day, can this product be obtained over the counter?
Oh, I can get that one too. ATRIDOX can actually only be acquired with a prescription, but currently it is discontinued, so you can't actually get it anywhere.
Since there are no more questions, let us open up a poll to the public. What are your thoughts about ATRIDOX? Should it be brought back onto the market? We're going to send a link, and if you guys can take a couple seconds to answer if you think it should or should not be brought back onto the market, just let us know. Thank you.